Hello, my name is Regina Brown, and today I will be discussing the moral right to health care. And to talk about the moral right to health care, I will be discussing the Code of Ethics, um, resource allocation, as well as cultural competence. So the Code of Ethics is is the foundation of what good healthcare is based on. The debate is ongoing still as to whether healthcare is a right or a privilege, but there are over 70% of Americans believe that healthcare is a right. When it comes to resource allocation related to great healthcare, there are many things that need to be considered. A lot of organizations have gone to using the health technology assessments to make decisions about benefits and risks and costs that are associated with healthcare. One of the things that they can really hone in on when they're trying to make these decisions is whether a drug should be listed on a national formulary or a local formulary. And as well as those kinds of decisions, providers and organizations also have to keep in mind just the daily things that affect resources within an organization, such as staffing, promotions, hiring, and marketing. All of these things come with a price tag, and it has to be considered when we're talking about resources. Healthcare leaders are expected to make ethically defensible resource allocation decisions that leave little or no room for unfair or equal treatment. Two of the factors that will increase the complexity of these decisions and the demand on the healthcare in the very near future are the age-related illnesses of the baby boomers, as well as whatever decisions are made about healthcare by the government. Those will definitely affect how resources are used in the medical arena. Also, when we talk about moral right to healthcare, we talk about cultural competence. And cultural competence is the ability of an organization to efficiently provide healthcare services that meet social, cultural, and linguistic needs of patients, and it plays a very, very large role in healthcare today. A healthcare organization that is culturally competent helps to improve health outcomes and the quality of care, as well as help in the elimination of racial and ethnic health inequalities. Some of the ways that we can do these things as healthcare organizations is to provide training to our staff and establish guidelines that decrease administrative and language barriers to patient care. Patients who have regular doctors enhance the likelihood of obtaining health care when it is necessary. People who don't have regular doctors are less likely to receive treatments, diagnosis, and management of chronic conditions, therefore resulting in poorer health. Patients with chronic illnesses require a lot more attention from the health providers, which increases the encounters with the healthcare system. So we want providers and organizations who are culturally competent so that as they see these patients more and more often, they can work together, physician and patients, and build relationships that will help the patient have an active role in improving their care. African Americans and other minority groups report less partnership with their doctors. Lower quality patient and physician relationships lead to lower overall patient satisfaction. So in an effort to raise the bar on cultural competence of the healthcare industry, health professionals must receive appropriate training to learn how to provide services in a culturally competent manner. It is a process that is developed in stages, and and you build upon the things that you already know. So I hope that you have learned some things today about from my presentation about the moral right to healthcare, and thank you.